Hello students, in this video we will study pubic bone, pubic part of hip bone. Pubis bone, it forms anterior 1/5 of acetabulum. It is located, means it forms the anterior margin of this obturator foramen and located anterior to obturator foramen here. It forms roughly 1/5 part of the acetabulum. It is having various parts. Body, this is body of pubis, this is superior ramus of pubis, and this is inferior ramus of pubis. Body of pubis, it is having superior border, or this is called as pubic crest. Lateral end of this pubic crest is elevated lateral end, and this is called as pubic tubercle. Then surfaces of body of pubis, this is anterior surface or femoral surface. Posterior surface is posterior surface, also called as pelvic surface, because it forms the wall, anterior wall of the true pelvis. And the medial one is symphysial surface. This is symphysial surface. This is superior ramus and this is inferior ramus. Superior ramus, this anterior surface of this pubis, this is directed downward, forward, and slightly laterally. Pelvic surface, it is directed upward and backward, and symphysial surface, it is directed medially. Along with opposite hip bone, it forms pubic symphysis. This is superior ramus of this pubis. It is having 3 surfaces and 3 borders. This is superior border or pectineal border, also called as pecten pubis. This is anterior border, called as obturator crest, and this is inferior border. Superior border, it extends from the pubic tubercle up to the iliopubic eminence. This is superior border, also called as pecten pubis. Anterior border, called obturator crest, extend from pubic tubercle up to the acetabular notch, lateral end of the acetabular notch. And inferior border, it forms the anterior margin of this obturator foramen. It forms anterior margin of obturator foramen. Surfaces in superior ramus of pubis, this is pectineal surface in between superior border and the obturator crest. Means pecten pubis and the obturator crest. This is called as pectineal surface. This is anterior surface or obturator surface, and this is posterior surface or pelvic surface of this superior ramus of pubis. The inferior ramus of pubis, it is joined with the ramus of ischium and forms the conjoint ischiopubic ramus. This forms conjoint ischiopubic ramus. Then regarding attachments of this pubic bone, pubic tubercle, this give attachment to the medial end of the inguinal ligament. Medial end of inguinal ligament is attached to pubic tubercle. Then obturator crest in lateral part, it give attachment to rectus abdominis muscle, lateral end of rectus abdominis, and pyramidalis muscle. These are attached to lateral part of this pubic crest here. Then anteriorly, in the angle between this anterior margin of symphysial surface and the crest, there is attachment of adductor longus muscle. Here there is attachment of adductor longus muscle. Then in lower part Of this surface there is attachment of gracilis muscle which extend over the ischiopubic ramus. Above gracilis muscle there is attachment of adductor brevis muscle, and above this there is attachment of obturator externus muscle like this. So this is attachment of obturator externus, part of attachment for the pubic bone. So adductor longus muscle, gracilis muscle, adductor brevis muscle and obturator externus muscle are attached here. Then this anterior margin of this symphysis surface here, it gives attachment to anterior pubic ligament, which is ligament of this symphysis pubis. Pelvic surface of the symphysis pubis, it gives attachment to levator ani muscle, here levator ani muscle and puboprostatic ligament. More medially there is attachment of puboprostatic ligament, and this surface is related to urinary bladder, and near the margin of this obturator foramen on inner side there is attachment of obturator internus muscle. Here there is attachment of part of attachment of obturator internus muscle. So these are attachment on the pelvic surface. Then superior ramus of pubis, pecten pubis, in medial part it gives attachment to conjoint tendon. Conjoint tendon is formed by internal oblique and transversus abdominis muscle. So that is attached in the medial part of this pecten pubis. Anterior to pecten pubis there is attachment of lacunar ligament. Here there is attachment of lacunar ligament which is formed by extension from the medial end of inguinal ligament. Medial end of inguinal ligament. So here there is attachment of lacunar ligament. Then rest of this pectineal line, it gives attachment to pectineal ligament, which is again modification of the inguinal ligament. So here there is attachment of pectineal ligament. Pectineal surface, this give anterior to this pectineal ligament there is attachment of fascia covering the pectineus muscle. Here there is attachment of fascia covering pectineus muscle, and pectineal surface, this pectineal surface, this gives attachment to pectineus muscle, which is muscle of the anterior compartment of thigh and the adductor hybrid muscle, muscle of anterior compartment and adductor compartment of the thigh. Here there is attachment of pectineus muscle. Then this canal obturator groove, it is converted into canal by attachment of obturator membrane and transmits the obturator vessels and nerves. This groove transmits obturator vessels and nerves. And posterior surface of this ramus, this is smooth and forms the anterior surface of true pelvis, and it is related to round ductus deferens in male and round ligament of uterus in case of female. These structures are related here. Then this lower inferior ramus of pubis, it is continuous with the ramus of ischium and forms the conjoint ischiopubic ramus. So that will be described in different video. Okay. So this is about pubic and superior ramus of pubic and their attachments. Thank you.